We're considering this an antiretroviral-free HIV remission. In a sense, stopping antiretroviral therapy and not seeing rapid or even low-level rebound of virus within the blood. What we've seen so far after 18 months is that seems to be the case. After stopping therapy, it very much looks like Timothy Ray Brown, where there's really no detectable HIV, especially from using clinical assays and routine standard testing in the blood. Whether this is going to be permanent, I think we need another about 6 months to 2 years to really know if this is going to. I'm actually optimistic. I think that the London patient will be very much like Timothy Ray Brown, and I certainly hope so as well. It would be exciting, obviously, for our field. 2 is better than 1. More than 2 is even better. But I think that at this point, there's a small chance that there could be viral recrudescence, although I think that most of us are optimistic that we will see something very similar to Timothy Ray Brown. Timothy Ray Brown did have a little bit more intensity conditioning for the transplantation. Whether that actually made a difference in terms of the HIV-free remission, or excuse me, the antiretroviral-free HIV remission, a little less clear. I think that the main point is that both individuals, the donor cells have come over and become essentially 100% of their blood cells. And that can happen with any type of conditioning regimen. But because both of them achieved this, the donor takeover, complete donor takeover in the blood, that has really made us excited that what we're going to see is continuing what we saw with Timothy Ray Brown. Now, obviously, Timothy Ray Brown had some complications from the 2 transplants that he did receive, and I really hope that these types of complications don't also happen to the London participant. But stem cell transplant is not without risk, and there can be short and even longer term consequences of allogeneic stem cell transplantation. So I really hope that he will do well. So this case really reproduces what we saw with Timothy Ray Brown. So in terms of the amount of new information, in terms of what actually is causing this HIV remission, I think is somewhat limited. But what I do want to stress is that the case is exciting because it tells us that we're on the right track. It says that there are other therapies that do not involve full stem cell transplantation. We saw a few of them today in the morning sessions. For example, gene modification therapy, modifying stem cells to reduce CCR5 expression. That there are ways of going about and doing similar types of treatments, but without the morbidity and without that. And I think that it is therefore exciting and really invigorating for our field to know that we're on the right track. It's going to be slow. It's going to be difficult, but at least we know that we're going in the right direction.